Hi, I'm Dr. Richard Visser, and in this podcast, I will take you on a journey through the wilderness of scientific research and experiential knowledge. Together, we will clear a path to optimizing health, well-being, and longevity. I am a former Minister of Health and Sports with a PhD in medical sciences, a published researcher in the fields of obesity, lifestyle medicine, and longevity. I started my career path over 3 decades ago as a doctor of chiropractic. I'm excited to share my methods, know-how, and experience with you. So please join me on the Visser Podcast. Welcome to the Visser Podcast. This is episode number 9. I think I'll take 2 or 3 episodes out to really discuss the basis, the basics, I guess the foundation work of mental well-being. We're going to start today with discussing major depression, and we'll skip bipolar side of it. This is not my expertise, so we really want to kind of limit it to basic ideas, what we can do, how we can mitigate this. And always remember, if you experience anything we talk about, if you feel that this is you, go see a healthcare professional, go see a psychologist, psychotherapist, psychiatrist, because that's what you need to be doing. You need coaching, just like anything in life. When I work, I've been working out my whole life, and I still go to the gym. I still at times get a trainer to really look at things from the outside and help me through major stuff. I do this with my science. I do this with my training. I do this with windsurfing, with barefoot water skiing. No matter what it is, snowboarding, you always get a coach. So when it comes to mental health, why not get a coach? Why not get someone to help you work through some stuff? And this is something we need to be open about, and we need to make use of. So let's dive in. We know that the number 4 cause of disability is depression. So it's a big one. It's a big one. And you know, initially we're gonna just talk about major depression and some of the stuff we've already learned in the previous episodes that we can apply to this. So to start with, we have to understand that for psychologists and psychiatrists, language is their so-called dissection tool, because that's how they get their diagnosis for depression. They're not, you know, they're not using lab work. Well, sometimes they are. They're not using X-rays, MRIs. They're not using any imaging or anything like that, or any other testing. They're really, language is key to kind of dive into the psyche. So what is the criteria that is used? And you know, it goes from very simple stuff that you kind of say, well, that's kind of normal. Well, sometimes it is, sometimes it isn't, depending on the intensity. So we look at excessive grief. And we've all experienced grief. And if you haven't, you will. You know, a loved one dying, whatever, your pet dying. I mean, and this, we're all different. So sometimes it can be experienced as excessive grief, and then it can be damaging. So you really have to look at this and not take it too lightly. And some of the other stuff is like having a low threshold to cry. Now, believe it or not, when I see sad movies, especially dogs and stuff, I cry easy. Okay, or like romantic, I cry. So I'm a wimp that way. That doesn't mean I got a low threshold. That says who I am. But if you notice that someone has a real low threshold, I mean, anything triggers it. That's what we're looking at. Anhedonia, the lack of ability for enjoyment in life experience. Okay, this is it can be, you know, guilt, anti-self-confabulation, meaning you make up stories why you're less, and you just feel less, and you start feeling less and less and less, and like you don't matter. The other one that we look at is vegetative symptoms, like you really don't have any desire to do anything. You just want to kind of sleep. People sleep a lot. They're exhausted all the time. They're not getting enough sleep, but but they can't sleep. Disrupted sleep. So people that complain of not being able to sleep well, that's also a good sign of depression, that there's maybe depression at play. A lack of appetite or increase of cravings. This could be related there. And anxiety, layered on. I haven't achieved anything in life. I'm this old. I'm behind everyone. I'm just this whole idea of this self-mutilation of, you haven't achieved enough. You need to be doing more stuff and you're not, and you can't get yourself to do it. So all these are kind of the markers, the easy markers that we see. And again, if you see any of this, if you recognize it in yourself, it might be normal, but it also, if it's a little too much, then it might be something that needs to be looked at and where you can use some coaching in. So please see your healthcare professional. We are here just to discuss ideas, to discuss the science behind this, to discuss what we're seeing and how we can kind of help you go through the science and really get some ways to work with it. So if we look at this, we got the biological basis and we got the chemical basis of depression. So first we're going to look at the biological basis for depression. In the 1950s, they kind of developed the tricyclic antidepressives and MAO inhibitors. And so these were to increase the norepinephrine, but they had side effects. They impacted the libido, digestion, dry mouth, bunch of, so they weren't really good. Then they started going into looking at the pleasure pathways in the brain, stimulating these brain areas. So more with working with dopamine pathways stimulation. So that's where we get to the SSRI, selective serotonin reuptake inhibitors. So stuff like Zoloft and, these type of medications. But what we're seeing here is 1 out of 3 people don't get better. Prozac is also one that, as shown to reopen neuroplasticity and neurogenesis. So this is also one that is being used. But really, when we look at, okay, what the causes are, so up to now we're looking at a couple of things that we've talked about in the past, which is norepinephrine, right? Activity, alertness, dopamine, which lack thereof causes anhedonia. So we really need dopamine for happiness. And remember, where did we talk about dopamine? A couple of things. We talked about it specifically in the gut biome, and we'll get back to that and how we can monitor that. If you got a bad or insufficient gut biome, it's not diverse enough, you're not eating enough fiber, you're not feeding the gut biome well, then you got a dopamine problem, because you're in the gut biome, you're converting, chemicals that we'll talk about to dopamine and causing the happiness feeling. So that's one. Serotonin with grief, guilt, shame. So we're talking about how we can optimize the serotonin also naturally. So one of the other drugs that's widely used is Wellbutrin, and that's a dopamine and norepinephrine increase. But problem is it's addictive. Okay, so not too good. On the second part, the chemistry of depression, we look at emotional pain, the physical connection to emotional pain. People go into painkillers. We're talking here about substance P inhibitors. But really, when you go into painkillers, there's a big chance of addiction, a big chance of, dependency. So this is also one that's you need to be careful of. The hormones that relate to major depression, 20% have shown to be low thyroid. So we really know, examples, Hashimoto disease, postpartum depression, also with cortisol in the thyroid system. So we really need to look at optimizing our thyroid gland, and when we're doing lab tests, to check our thyroid, see if that's, up to par. We get this with menstrual cycles. We get this with menopause, where these things of, depression can rear its ugly head. We also look, I think one of the big things that we're dealing with currently, because of the way of the world, is bouts of long-term stressful periods. So you have, this is stress in our life, or you go into war, and and exactly, that's that, and that gets classified as something else, PTSD. But it's just having extreme stressful periods or long stressful periods, and that's where you get increased cortisol release at the wrong time. And this is about 4+ bouts or more, can cause depression. So it can change your brain chemistry, where you start being depressed, and it's because your stress levels are too long. So we need to look at what? We need to look at how do we mitigate stress, and we've talked about this. So we'll repeat kind of some of these things that are helpful if you're at that point, if you're at that tipping point. There is a genetic predisposition, 5-HTT-LPR, which carries cortisol. Again, cortisol coming up again. And this one is in a person that, with fewer bouts of stress is already lapsing into depression. So you got to look at, okay, do they have this genetic predisposition? And so if they do, then we need to kind of change how we treat them and what we do for that and how we watch them. So one of the things that we talked about, and I'll talk about a couple of things, is, and this goes back to episode 5, episode 6, episode 1, sorry. So there's a couple of episodes going through here, but 1, learn to mitigate stress. We talked about this in cold emergence. So in hot and cold therapy episode, we talked about cold emergence and what this does to you, how it releases the dopamine, how when you're in there, you're getting trained to handle stress levels that are higher than normal. And so you're learning to mitigate everyday stresses. So cold emergence, we talked about 11 minutes a week, with 3 minutes every time you do it in cold emergence, what you can handle, that this shocks the body. And it basically mimics stress without the bad cortisol coming in. So you got all the other stressors in a short period of time, and you're really training your body to handle stress in real life. So this is one that we could use for mitigating stress. The other one, measure and adjust your thyroid levels. We talked about this because thyroid, can really take you into depression, and that's an easy one to adjust and level out. It's just a blood test, and you'll know, with a thyroid panel, and you'll know what you need to be doing. Your healthcare professional can assist you with that. Exercise. This is the basics. Like, we have some basics. The basics, nutrition, and the basic is exercise. Norepinephrine release, dopamine relief. We know how exercise dumps these into your body, where the feeling of happiness, it creates that feeling of movement, that feeling of purpose. It just exercise does so much. And I'm not going to talk about it because we talked about exercise. So go back to that episode to kind of look at that. But exercise is one of the things we need to incorporate to, avoid going into depression, or when we feel it coming on, get on it. Our gut biome, which I talked about before, we have a gut-brain connection, and one of these, one of the things that kind of starts triggering this is how we uptake tryptophan. So tryptophan is taken up, by the gut biome, and it's converted to serotonin, remember, and 5-HT, and melatonin for sleep. So we are, through our gut biome, are creating these happy hormones if our gut biome is healthy. So we need to look again at, okay, what we need to do here. We need to eat fiber. We need to, as much as possible, avoid, antacids, avoid, antibiotics. When really needed, take it. Antacids, if you really, really need it, take it at a short, period of time. Talk to your doctor about it, but get off it. Don't do it chronically. NSAIDs, all these things kill your gut biome. Okay, how do we feed the gut biome? With fiber, with fermented foods. Okay, boom, there you get it. So, you know, and the caveat here really is, and I'm explaining this, and it seems like, okay, we can all solve depression. No, it's much more complex than that. We're scratching the surface here, but I want to give you kind of a feeling of things that we can do to keep our mind healthy. You know, these are the first couple of things that we can do to help us stay healthy, help someone that's on edge come back to the healthier side. If you have depression, you know, if you have major depression, you may not have the ability to get up or do anything. That's part of the problem. So when you see people with major depression, all they want to do is curl up in a dark space and sleep as much as they can. They have nothing. There's nothing in their body that tells them, hey, let's go exercise. Hey, let's do a cold immersion. Are you kidding me? No, they don't want to see people. They want to talk to people. They want to be alone. They want to. So if it's this far, yes, then you need professional help, and you're gonna need maybe help with pharmaceuticals combined with the techniques we talked about and other techniques that we will talk about to really get out of it. Okay, so what are the stress systems? Well, we got excessive inflammation, and we have the immune system. Reducing chronic inflammation in the body and brain. You know, here we talk about C-reactive protein, we talk about IL-6, TNF-alpha, glial cells, and the disrupted dialogue with cells. So this is kind of, you know, going into an area that we say, okay, here is, we're crossing the blood-brain barrier. We're talking about lymphatic system, sorry, slipping my mind. And so what can we do about it? Well, we've found that the intake of, or increasing your omega-3 fatty acids, EPA especially, can mimic SSRIs. So SSRIs, again, are the selective serotonin reuptake inhibitors, and lower the dose if you're using them in combination. So we're talking about 1,000 milligrams to 2,000 milligrams a day is the threshold. And on the cardiovascular side, we see that every gram you increase of fatty acids helps you 9% in your cardiovascular risk rate. So it's good there. It's, you know, anti-inflammatory, etc. The inflammatory cytokines affect synthesis of tryptophan. And so, you know, dopamine and norepinephrine, so the tryptophan pathway, which goes to serotonin, which is when good, but if inflamed, then a new pathway of neurotoxicity is taken. So again, what do we look at the fix for this? Exercise. Exercise has an effect on, and it shuttles the neurotoxins into the muscles. Zone 2 cardio, we talked about this. So when the body starts releasing neurotoxins because we have we got inflammation going on and it's taking the wrong pathway, exercise again can come to our aid. So if we want to look, and we're going to kind of put some publications here. You look at EPA on depression, and that's in examine.com, PubMed. EPA meta-analysis, Julian Martins. So we got a couple of sites where you can read the research on this and really inform yourself. And always do your homework. You know, listen to what I say, but really do the homework. Look at the backup stuff that I'm using. You know, even scientific works get interpreted in certain ways and maybe sometimes can be misinterpreted. So we like to look at, you know, a bunch of studies of the same topic so that we can have a better idea of how the study was done, how it was implemented, kind of the stuff you don't see. A very good friend of mine, neurosurgeon, has a saying. He says, and he got this from his professor in Europe when he was doing his final set there, and it's this: data, and we come from the Caribbean, so this is normal for us. Data is like a bikini. Very interesting what you see, but vital what you don't see. So, needless to say, we sometimes really have to look at what we're not seeing, what they're not telling us, and in the study, and be able to then to dissect and say, okay, how much value does it have to what we're, to what it is? Because that's why studies can change with time. So when we look at another thing that, so we talked about supplementation, we started talking about supplementation. The other supplementation that we're looking at is creatine. 3 to 5 grams a day increases phosphocreatine system activity in the forebrain, involved with reward pathways, mood, and depression. So it increases your mood. So guess what? Creatine does not only work for helping in the gym, but also with your mood. So this is another, and it's 3 to 5 grams a day. This is another supplement we can take. And again, the review is in the research. So when we look at one other aspect, which is, and this kind of brings us into new territory. Okay, what's the new territory? What's the territory that we're looking at for the future of major depression and management and treatment thereof? We're looking at NMDA receptors for neuroplasticity. Increases from negative to positive mood. Drugs being tested that might work, but are on the edge. They're not FDA approved yet. They're not approved for use, but there's a lot of research going on. Ketamine, PCP. I know these are also drugs that are abused. So be careful. We look at I think one of the good papers is the Nature paper 2020. Sam Fazuna Disarov. We talk about layer 5 neurons activity, the rhythm activation of retrosplenial cortex. So this is very interesting stuff happening. We experience a separateness from our experience. So what these drugs help us do with the NMDA receptor is that it allows us to kind of distance ourselves from the negative experience and be able to view it from a distance, which gives us that space to kind of recover where we're not in it the whole time. Because when we're in it the whole time, it is very hard to get out of it if you're that, if it's got such a big grip on you. So with these drugs, they're able to give you some perspective, give you that time to, to disassociate from the experience, and that has been shown to be helpful. And we're looking at Science 2019, Liston, sustained rescue of the prefrontal. Well, you can again, we'll show you this so you can look it up. And this is where we're also looking at more spines on the end of the neurons. More connections means more neuroplasticity, more change possible, especially with depression, tired, non-responsive, bummer, heavy, anti-self confabulation, self-harm, mutilation, and sometimes even suicide. So we really want to be as neuroplastic as, have as much neuroplasticity as possible. And this happens when we have more spines, more kind of areas that connect between the synapses. So this is very important. So I think the last part of this section would be the psychedelics. Psilocybin, magic mushrooms. I think here you got Matthew Johnson's work. We're looking at increases of serotonin. JAMA Psychiatry 2021, major depressive disorders. And really the prescription of psilocybin is done in capsule form. And we're looking at a 50% mood increase, changes, improvement. So it's really, the psychedelics have shown to be really effective in the initial studies, and really effective in rewiring the neural circuitry. Layer 5 of the cortex, the lateral connectivity with 5-HT1A, enriched receptors merging, different senses activation of their serotonin system, rewiring the attachments to the events and seeing it differently. So again, it's that rewiring, detaching, being able to look at it differently, putting it in perspective. And sometimes when we're dealing with major depression, we're unable to do those things. And those things that we take for granted if we're, healthy. So we'll also talk to John McKenna on ayahuasca. He's one of the researchers I've worked with and developed my vitamin line with him in the past. Worked with, he's the plant guy. He's the natural guy. He knows everything. And his work with his brother in the field of ayahuasca has been shown everywhere. It's a good one, and we'll have a separate episode on that because I want to really interview him and go through it. So the NDMA is being used for trauma treatment, and another thing that I think is interesting here is that we've seen with this specifically that ketogenic diet increases the GABA receptor, modulate GABA. You got glutamate activity for epilepsy, especially in children. Also major depressiveness may be able to benefit from the ketogenic diet. So ketogenic diet is starting to play a key role here. It's starting to play a role with epilepsy in children, especially in making it less frequently. And we're also seeing that maybe in chronic depression, chronic major depression, ketogenic might play a role. And it's not with everyone, but it's something definitely to look at, to check, to test. I mean, changing your diet is one of the easiest things you can do. I mean, compared to going through a treatment with pharmaceuticals, going through a psychiatrist. I mean, this is in your own control. You can try it out and talk to your physician always when you're changing anything. So in this first part, looking at major depression, I know we hit a lot of stuff we went through, but we needed to cover the basics so that we can go on, so that we can look at, okay, in our next episode, we will be going more, and a lot of you will like it. Maybe you'll like it less, maybe you like this more. We'll go the effects of meditation and what types of meditation, TM, yoga, Tai Chi, different ways to really center, to get to the source, to try to lose the identity that you have of who you are, really, because this hampers us. Okay, so and you'll get it back. It's not like you're losing it, just for a little bit, so we can go to zero, so we can get to a place, so we can get to the gap. So we're going to talk about spiritual practice and connecting to the source. So this is your episode 10. Thank you. Join me next time and subscribe, ring the bell notification. Thank you.